Hi everyone, I am Kaitlin Ryan, Doctor of Physical Therapy with Physio Ed. Thank you for joining today for this Q&A where we are answering your questions. If you have any questions, please join us at Physio Ed Connect for free, where you can submit your questions for me to answer here. Just as a reminder, all of these answers are given as just a general education and movement strategies, and none of this is intended to individually diagnose or provide individualized treatment. So if you have any specific concerns, please reach out to a local physical therapist or provider in your area. Again, please join us at Physio Ed Connect, where you guys can submit your questions in case you have any follow-up questions or if you would like a question to be asked that has not been asked yet. So thank you again for joining me, and we'll just start jumping right in. Our first question comes from Paul, who is 70 years old. He says that he was diagnosed with hip bursitis last year and he had to stop gardening. So he's wondering which movements should absolutely be avoided and if there are any gentle stretches that he can be trying now. So for people who don't know, hip bursitis is an inflammation of the bursa, typically in the hip area. A lot of times it's over kind of like our outer hip bones. So bursa is just kind of a fatty protective tissue that is actually throughout the whole body. There's tons of different bursas, but hip bursitis or knee bursitis is kind of the most commonly heard about ones. And the bursa becomes inflamed with this bursitis. And so that inflammation can happen for a number of different reasons. Sometimes it could be a direct trauma to that bursa. Sometimes it is an overuse or an improper repetitive use of muscles or that joint, I should say. And so that can cause an inflammation of that area. Sometimes having one leg that's shorter than another can cause that. Repetitive motions, sometimes prolonged running, prolonged cycling, those are other things that could be causing that. And it sounds like maybe gardening was one that we are having difficulty with. So I think a great article that I am going to be recommending to anyone with the hip bursitis is, it's actually called Exercises for Hip Bursitis on our Physio Ed website. So I highly recommend checking that out. It goes into more depth about what bursitis is, what causes could be happening. I would recommend to Paul definitely wanting to stay away from kind of prolonged positions with garden. It might be a really good idea to be switching those things up. I don't know if you're going to have a direct contact or if there's a specific motion or position that makes that bursitis flared up, but I would really reduce how much you're staying in one position with the gardening. Sometimes you can be in one position for almost hours if you're not careful with what you're doing. Maybe you need to be taking breaks if you're going to be returning to gardening, only gardening for small amounts of time to kind of slowly build up so you don't overdo it and overuse anything. So I can't say specifically, maybe you want to be staying away from squatting activities. Sometimes squats can actually provoke or re-aggravate that bursitis pain. So that might be an activity where you want to try and modify in a different way, whether that is changing your positions like standing, then switching to sitting or kneeling or the kind of hands and knees position, just trying to switch it up what you're doing. And I would stay away from a specific activity that makes that pain worse, if at all possible, or different ways to kind of modify it. Now, on that article, Exercises for Hip Bursitis, there are a few exercises and stretches that you can be doing, Paul, that is going to be really beneficial for you. The big focus is working on strengthening our hip muscles and quadriceps strengthening as well, in addition to stretching the tissues out around that hip joint. And we're going to include a link to that article in the comment section for this video. So I would recommend you just click on there. They're a little bit complicated, so I think going to that article is going to be the best bet for you, Paul, there. So hopefully that is helpful for you and that you can check out that article and that can give you some ideas of what things you can be doing to start getting back into gardening. And again, I would recommend trying to start with small duration of gardening. And if you're going to be doing it, try and switching up positions as you do it. Try and build your tolerance back up if you can. All right, so thank you very much for your question, Paul. Our next question is from Angela, who is 63. She says that she has started helping take care of her new granddaughter. Congratulations on your new grandbaby. She has been lifting her in and out of her crib, and sometimes that can be bothersome to her back. So she's wondering what the best way to protect her back is while still being able to hold and play with her new granddaughter. So there is a video that we have that we can also link into this that I did really focusing on good posture. The best thing that you can do, now the video shows lifting some boxes or some items from the ground, but the best thing you can do when it comes to a crib is trying to get as close as you can to the crib and the baby, and try not to do a whole bunch of, reaching forward or really leaning over as best you can. Maybe instead of your back bending, maybe you're trying to focus on, using your legs and squatting down a little bit to try and get lower to help reach her. And always want to keep the your grandbaby nice and close. So when you are lifting, the closer you can get her as you lift, the better that is going to be for your back. So that is something that is really beneficial for any sort of lifting, trying to keep that the weight or whatever it is you're trying to lift nice and close. But if you're having to bend down or bend over, trying to reduce it as much as you can. So I'm not sure if there's something you can do where you can lower the edge of the crib so that you can more easily get to your grandchild without having to kind of bend over at all. So Angela, I hope that is helpful for you. With those motions, what is really beneficial is to kind of work on some core strength as well and try and really focus on a good posture and good position when you're doing that. So sometimes it has nothing to do with, changing, big things. It's just kind of little things and resetting yourself and setting for a good posture and just focusing on your positioning. And sometimes that's all you need to do to kind of relieve some of that back pain and stress with lifting or things like that. All right, so hope that was helpful. The next and last question comes from Sharon, who is 67. She says that she's read our article on core exercises. Thanks for checking that out. She said that her doctor also mentioned that osteoporosis and the risk of compression fractures. So she's wondering how to safely strengthen core muscles without putting her spine at risk. So Sharon, I'm not exactly sure which core exercise article you checked out, but the most important thing for osteoporosis and prevention of compression fractures is going to be a neutral spine alignment. We do have multiple videos on that. We can put some links in the comment section for this video. And I am also going to include, or we are also going to include, a link to a video that I did where we're going through some core exercises and they are just lying down on your back on the ground. And that is going to help to prevent a compression fracture as long as you're getting on and off the ground nice and safe. So some simple exercises could be something where you're just kind of like a heel tap or a toe tap to start off with, really engaging your core muscles, kind of pulling the belly button back towards the spine and making sure you're not overarching or flexing too much. So you would want to refrain from something like crunches or sit-ups. That's really going to put you at a higher risk of a compression fracture than something like if you were to do a plank or something like that. So we'll put a link into that video. They're pretty gentle exercises where you're on your back, so you're not going to be overstraining your core muscles. And as those get easier, things like a plank will be easier to do as well. So hopefully, Sharon, you find that helpful. It's a great place to start. And for anyone who is listening to these answers, if you're feeling you're not getting quite the satisfaction that you would like out of these responses, we are going to be starting to do our one-on-one telehealth physical therapy sessions. We're going to be starting out, I believe, in the state of Wisconsin. So hopefully, if you guys have any questions and you're living in that state, you can join us and sign up for our one-on-one telehealth sessions, really about preventative therapy. So check that out. That'll be on PhysioEd.com's website. Please give that a try. Thank you guys so much for submitting your questions for us to answer here today. If you have any more questions you'd like us to address in this Q&A, please submit them so we can answer them and hopefully others can hear. And thank you guys very much for joining me today on Physio Ed's Q&A webcast. We're just trying to help people with preventative therapy and to stay healthy and active for a lifetime. Thank you.